We're all here. I am here today to talk to you about your heart. Not this heart entirely, but this heart. I'm a cardiologist. I spent the last 2 decades as the director of women heart health programs in 3 major hospitals, a physician who's seen thousands of patients, and now the CEO of a tech company dedicated to heart prevention in women. I've spent my entire life working to keep this heart healthy. And what I've learned is to do that, we have to get back to this heart. It holds the answer to one of the biggest threats to women ever. So come on a quick journey with me throughout art, philosophy, science, and literature, because we know that the heart has been a powerful symbol of who we are, and it's been a powerful symbol of what it means to be human. We get heart sick, flutters in our chest, heartbreak, drool over our heart throb, and we all have experienced heartache. Throughout time, the heart has been depicted as a symbol of love, passion, and emotion. We can go back to Plato, who speaks about the dominant role of the chest, or Aristotle, who granted the heart supremacy in all human processes. Or go back to the 7th century BC, where the poet Sappho wrote, "Love shook my heart like the wind on a mountain." Or Shakespeare's Romeo asking, "Did my heart love till now?" And what about this? "My first heart throb, red herb in blood with a nice Jewish girl on the other. Be still, my heart." Did you ever wonder about why the ring finger is this one? The ancient Romans believed that there was a vein that extended from that finger directly to the heart. And what a perfect symbolic way to start a life together. This beating heart, this organ, has been described throughout time as a system with feelings and intelligence and an understanding of who we are. And you know what? They were more right than they ever knew. The heart, in fact, is more similar to our symbolic heart than we ever really appreciated. And it goes throughout days with us. It carries our burdens. Our heart is the center of our own personal universes, acting as a metronome of our lives. It beats with the highs and lows, absorbing our lifestyle choices. I'm proposing that heart care is the new self-care. It means that you need to listen to your heart and demote your brain as CEO, but we have to have a real understanding of our own hearts before we begin. We need to become educated, empowered, and our own best advocates. We have to start with the history of the heart in this century and how our disconnect to women's hearts began. In the 1960s, the American Heart Association had the first conference on heart disease for women entitled, seriously, "The Way to a Man's Heart." Are you ready for this? The 1990s, the cover of Reader's Digest. Is your husband headed for a heart attack? Prior to 1984, no research was done on women's hearts, and for the first time, women started dying of heart disease more than men. But things started to shift in the 90s, when finally there was the Office of Women's Health, and research began on women's hearts, focusing truly on the physiology, diagnosis, and treatment. But it's only been 30 years. It takes about 15 to 20 years for research to hit clinical practice. Our knowledge is in its infancy, and the doctors are still uninformed. Heart disease is the #1 killer of all women. 1 in 3 women will die of heart disease, more than all cancers combined. 70% don't know they're sick. 80% of the time it is preventable. But let's focus on changing the 1 in 3 women dying to the 4 out of 5 living. And living well, being healthy, active, beautiful, energetic, and vital. So let's learn the truth, because it has not been actually explained to us the way it should have been. In fact, even Hollywood paints heart disease as being a man's disease. Here what we see, Mr. Big drops dead on the Peloton in the Sex and the City reboot. True story is Peloton stock started to drop. And hashtag Death by Peloton went viral. They called me. And I assured everyone it was not from the exercise, it was probably from the cigars and steak. I got a bike out of that one. Anyway. Hollywood is not the real problem. The problem is the same thing as happening in your hospitals. A study shows a man and a woman going into the emergency room and reading the exact same script to the doctors. Guess what happened? The man was admitted to the hospital with a diagnosis of possible heart attack, and the woman was discharged with anxiety. Multiple studies show that unconscious bias, the medical gaslighting, the delay of care, the inequity in diagnosis and treatment strategies. In fact, one study showed that women had a 59% greater chance of misdiagnosis, guess, compared with men. The standard of care to diagnose heart disease is designed for men and often misses disease in women. With men, disease is local. It's in one part of the artery, causing massive heart attacks, clear symptoms. In women, the disease is diffuse throughout the arteries, making it much more difficult to detect. And the symptoms? They're more subtle, just like we are. Shortness of breath, jaw pain, back pain, nausea, vomiting, even flu-like symptoms could be on hearts. These major risk factors, high blood pressure, high cholesterol, diabetes, elevated sugar, smoking, these apply to both men and women. But that leaves out some of the most important issues that pertain to women that are not even asked about. And because of that, doctors mostly underestimate the risk of heart disease, especially if you're less than 65 years old. Some of those risk factors include adverse outcomes of pregnancy, like preeclampsia, gestational diabetes. Over 50% of Black women will experience some form of heart disease, oftentimes blood pressure in your 20s. And what about menopause? We spend 40% of our lives in menopause, and 70% will have some form of heart disease. A risk assessment that determines how someone is medically evaluated and treated. It is a critical step in how we see ourselves and how doctors need to see us. We need to know our accurate risk. Has anyone ever talked to you about your cardiovascular risk? But only 40% of the time are doctors actually using a risk assessment. 22% of primary doctors, 42% of cardiologists actually understand it. But only 1/3 of doctors make it a priority. So what does that mean? You need to know your risk. You need to be empowered. For example, autoimmune disease increases the risk of heart disease threefold. Gestational diabetes increases the risk by 60%. Menopause has a 4.5 times higher risk of heart disease. And depression doubles the risk. In fact, the connection between the mind and the heart is critical. We intuitively know that stress and depression increases the risk of heart disease, but it wasn't until 1994 that research was done giving some insight to this. A study was done looking at the cells of the heart. Listen to this. They did biopsies of the heart and they evaluated these cells, and what they saw was that these cells looked exactly like the nerve cells found in the brain. It was at that point that the heart was called the little brain, functioning and responding to emotions the same way we perceive it in our minds. We know that stress alters how we act and the healthy choices we make and how we perceive the world, but it directly affects our stress hormones. And the trigger of these hormones lead to inflammation and high blood pressure, stiff arteries, and eventually heart disease. You know what else the risk assessments don't ask about? Everything that's happening in that little brain, part of your heart. The depression, the anxiety, yes, the stress. That little brain is feeling all of it. And it isn't just this romanticized myth. We can actually see that burden through testing and diagnostic tools. You know, that heart rate variability that's right on your smartwatch? That's the little brain. Heart disease in women costs about $194 billion a year in direct and indirect costs. The insurers, they pay half of those. Guess who pays the other half? We do. We need to shift the focus to wellness, which prevents disease in the first place and puts the power in your hands. Women have been told far too long that their greatest threat isn't real and that the problem is all in your head. The problem is not in your head, it is in your heart. Here's a typical story. 49-year-old female. She has 3 kids. She's balancing work, home life, periods are irregular. She might not have been exercising as much as she could because she's doing the juggling act. She might even gain some weight, but not terrible. And suddenly she noticed she's getting chest pain. It doesn't happen that often. It doesn't happen when she tries to exercise. It's just part of her daily life. And sometimes it actually happens when she's resting. She feels palpitations and flutters in her chest. She's a bit short of breath. And she ignores it. Out and down there? Until one day she can't. So she goes to her doctor, he does an EKG and examines her. She's fine, but he sends out blood work just to be sure she's okay. He calls her in a couple days and says, you know what, nothing is wrong. She gets the pain again, this time it feels worse. So she goes to a cardiologist. She gets a stress test and an echocardiogram, both are normal. They do a calcium score, the score is 0, and she's told again, she's fine. She goes to the gastroenterologist, rheumatologist, makes a couple of visits to the emergency room. She is then recommended to see a psychiatrist for stress, depression, anxiety, being overworked, or some other kind of nonsense. So what's happening? That lining of the artery, as we have risk factors for heart disease, or as we go through perimenopause and menopause, as that happens, the arteries do not dilate well. When we are going throughout our days, they are stiff and they are not dilating to provide us the oxygen that we need. So we get chest pain and we get shortness of breath and maybe we even get palpitations. But the issue is, especially in women, the disease is in the microvasculature, not the big ones. The ones that we could see on a standard stress test or through a coronary artery calcium score or a CAT scan of the arteries, or even a calcium score. In fact, almost 2/3 of women who are referred for invasive angiograms, who are suspected to have problems with their arteries, have normal arteries. They have a 2-fold increase in the risk of death by 5 years. They are 4 times more likely than men to be readmitted to the hospital within the 3 months, and there's a reduced quality of life. The diagnosis of microvascular disease is hard to make, and the symptoms are atypical and subtle. What I've shared with you today, that story and this physiology, is the essence of what happens to women over and over again. It is sometimes what leads to the silent heart attacks because we can't see those arteries. And other times it leads to elevation in blood pressure, stiff hearts, and heart failure. Women's hearts are just simply different from men's. And this happens to women 5 times more likely than men. And our testing and standard of care does not diagnose it. It isn't until the disease progresses, when you get sick, that the diagnostic tools we use, like typical stress testing and angiogram, can diagnose heart disease in women the same way it can as a man. The treatment is critical. It is getting the cholesterol down, and sometimes using a statin, getting the blood pressure to goal and lowering the sugars, decreasing inflammation and dilating the arteries. It's about diet and exercise, sleep and stress management, and this cocktail of treatment. But hormone replacement is part of this story, and it needs to be considered because it is all about prevention. The most critical part of this is actually you. A survey was done of 1,000 fairly educated women. I found this fascinating. 90% of them knew that heart disease was her greatest health threat, but only 13% said it was her problem. There's a disconnect. Women don't want to talk about the potential heart disease. They feel guilty, or like if they did more or could have done better, it would happen if they gave up sugar, exercised more, or didn't get so stressed out. They play the blame game over and over again, but it is not true and it is not helpful. So what is heart care? We all think of heart care like this, manicures and massages. Don't get me wrong, I love that, but heart care is more than that. It's focusing on what makes us the best we can. It's about living from this place that allows us to thrive. Self-care is about knowing exactly who you are and knowing exactly what you need to do to live your best life and then doing it. It's about paying attention to yourself. It's about knowing how to eat to fuel our lives, how to move to get us energized, how to sleep to ensure we feel restored and refreshed with stress management, like meditation or mindfulness, and how to relate to those in the world to support and sustain us. It's about balancing those parts of yourself until you are truly living from the heart. I mentioned earlier how your risk goes up during menopause, so let's get rid of that stigma and let's just talk about it. These risk factors of heart disease tend to develop during menopause, especially the big ones, like high blood pressure, high cholesterol, elevated sugars, and being overweight, as we lose that estrogen protection. But it doesn't have to be like that. Things can be checked that tell us if we're at risk. These blood tests I have listed above give us genetic insight into how risky it is. But first and foremost, get checked and know your risk factors. Talk to your family about your history of heart disease and stroke. And then remember, 80% of the time, heart disease is preventable, and you can do this. Do you know what one of the most effective cures for hot flashes is? Exercise. I tell my patients all the time to train for menopause like you are training for the marathon. 150 minutes a week, 30 minutes, 5 days a week, strength training at least 2 days a week. Using a cardiopulmonary exercise test, we can actually diagnose microvascular disease, determine an exercise prescription, and learn one of the most sensitive markers of cardiovascular vitality, VO2 max, something Dr. Vonda talks about, right? It's great. Sleep is critical. 7.5 hours. VO2 max is critical. But so is sleep. And 7.5 hours a night is important. Eating a healthy diet. I recommend the Mediterranean diet, low in saturated fats and high in omega-3 fatty acids, vegetables, whole grains, and fruits. Everything you would eat on the beaches of Greece or rolling in the hills of Tuscany. Practice meditation. Have gratitude. Surround yourself with supportive friends and family. And last of all, find purpose in life. Studies show that when you live life with purpose and passion, you live longer and healthier. This new path through the wisdom of ages creates a new mindset around heart health that will completely change the trajectory of this disease. What those philosophers, poets, and historians were trying to tell us, even down to the importance of that ring finger, is what the little brain revealed, that when we allow our hearts to live in its optimum state of love and passion, it thrives. You will make choices that nourish you and invigorate you and restore you through diet, exercise, sleep, who you spend time with, who you don't spend time with. And you might just laugh a little bit easier. Heart care is simply about loving yourself and never, ever failing the one you love. I lived my passion and purpose and started a tech company that created a software platform that empowered both patients and primary care physicians to identify the risk of heart disease and treat it. We changed the narrative from sickness to wellness, from heart disease to heart care. It's not about the fear of sickness, it is about how you want to live your life. Our software is called Adesso. It is Italian, the language of love and romance. And it means now. It begins with the heart score, where you actually learn your own personal risk and takes you on a journey, where you can ask yourself your now. What is your dream that propels you on a forward journey to lead a long and healthy life? From my book, I wrote, live truthfully and authentically, honestly, drawing strength and consolation from work, family, love, and health. Cultivate and nurture those things, not from your head where logic always rules, but from your heart where you can feel what is right and real for you. Live that way, and chances are things are going to be just